Hi everyone, my name's Rachel Desane and I work as a digital strategist. I've been lucky enough to work for some major global brands and been involved in digital media now for over 15 years. I work with clients in both public and private sector to help them understand how to weave these new digital technologies into their organisation for success. I'm passionate about the opportunities of technology and in particular consumer engagement and not just improving but revolutionising how we deliver health services. Earlier this year I was up in Far North Queensland, an amazing part of Australia. Do go if you get the chance. But I saw firsthand the difficulties a remote rural area has with multiple service providers, all with their own IT systems, and the amount of time spent on admin and operational duties rather than face-to-face care was an area I feel needs improvement. I also see tremendous benefit in using technology to improve aged care services, and I hope that more focus will be given not only on what the PCEHR can do, but a broader look at how technology can provide opportunities for patient safety and quality of life in this sector. My passion also comes from real life experience. This here was my bed for about 10 days, I think it was, in December when I had to have a bowel resection. And I'm here today as a patient. Like many of us, I have a chronic disease and I have numerous interactions with various health professionals, surgeons, GPs, monthly blood tests, all sorts of things. I think my running operation total at the moment is about 10 surgeries in 4 countries. So you can imagine I have a pretty large amount of data in my health record. I'm also, like many of us, got a few interesting health quirks. For example, my resting heart rate sits at about 45, so my normal is different to your normal, and I've struggled with the lack of personalisation in medicine. When my heart is racing and I'm feeling pain and I'm told by a doctor that, it fits in the normal range, well, I have to pull out my ECG, explain things, and, I think an electronic health record is hopefully going to help people understand that normal is not really normal. So, this fueled me to create my own, what I call PCPHR, the P in this case meaning paper. And I share my lab results, data, doctor's notes, and things that I've read online, either from medical sources or patient sources as well, so that when I'm in hospital or at the doctor's office, where, like many of us, I suffer from in situ amnesia and can sometimes forget the things that I want to talk about. So my PCPHR works really well as a memory aid for me so that I can really make the most of the time that I have with the doctor. What does the PCEHR mean for me? Initially, I thought of it as a place for me, the patient, to manage my health data and to have access to a range of tools, applications, directories to help me do that. Like my banking app or my e-tax that let me manage my data input and change it around, not just who has access to it. And you know what? In the first stage of the PCEHR, it's not. And you know what? I'm actually okay with that. Like many of my friends, I thought there was already a system that linked health information together. And in fact, I was quite surprised by how archaic the back-end systems and technologies in our health system really are. Doesn't your Medicare card do that? Was a phrase I often heard from friends when trying to describe the system. But really, phase 1 is more about the physicians and health providers. However, I believe if we can get System A talking to System B and enable fluid data to flow around the system, it will improve efficiencies and in turn will free up time for more face-to-face care and I hope lead to more personalised care. So in effect, the benefit really is for the patient. There has been some negative press, as there always will be with a national initiative. You can't please everyone, but I appreciate that NETA has created a platform to bring in key stakeholders, including patients, consumers, and that the consultation process for the PCEHR concept of operations enabled anyone to input their concern. I think one of the biggest concerns I have is around the balancing act, balancing the needs of all the various stakeholders who need to work together to make this work. One, from the patient's perspective, privacy and security. I initially thought that out would be the best solution, but had a good chat with some colleagues who work with at-risk patients, and I think that there are legitimate concerns, particularly with some of the MBS data being made available, that initially we're going to need to make it opt-in and focus our efforts on getting those people involved and getting those who really need an electronic health record to sign up for one. There's just as valid concerns on the other side with doctors around the quality of data and being able to trust that it's a valid record, and that, if a patient's chosen to not include some information, how can you as a doctor really provide care if you're unsure that some of the information isn't there? And, that's a valid concern. I also think sometimes we forget that vendors have a right to have an economically sustainable business, and what are the costs involved with integrating with these new systems requirements, particularly with, not that long to go. Some of these system requirements haven't even been made available yet. I've been quite shocked though by the vilification from both sides. Some doctors talking about irrational patients and, none of them remember anything, and, well, patients can't be trusted. None of us will use any system if patients get their hands on it. And also from some patient and privacy advocates who paint all doctors as money-hungry clock watchers who only care about ticking the box to get their rebate and not on the actual health outcomes for the patient. And, there's truth to both sides. As with any industry, there's good and bad. I've certainly met examples of both groups, but all in all, I really do believe that most doctors and health professionals are there for the good of the patient. And you know what? Most patients are pretty open to working together and want to be there to make their health better. Success to me in a relationship is one that's built on trust and mutual respect, and this relationship between a healthcare professional and a patient is no different. For me, if the PCEHR in its initial stage enables my chosen healthcare team to access the relevant, actionable information about me, and it means I don't have to remember things when I'm in pain, repeatedly fill in forms time and time again, not repeat costly, painful procedures, but most of all to feel safe, that information is there in a format that's relevant, trusted and actionable for my chosen care team. But we do have to balance that it cannot take away from any of the existing current privacy choices that I have in choosing who I share what personal information with. I was recently in the States at the Medicine 2.0 conference at Stanford and also Health 2.0 in San Fran, and patients were a major focus. Both conferences had patient tracks, and in fact there was even e-patient scholarships to bring in patient advocates to learn from them on how to improve the system and bring them actually into the conversation, which was fantastic to see. I also saw a massive push with some big investor money involved into the quantified self area. Loads of new gadgets and apps for people to monitor and track things. Everything from glucose levels to fitness activity, mood trackers, sleep monitors. And I believe this is incredibly useful data and can help understand someone's condition, treatment or overall health, and again lead to that utopia of personalised healthcare. Most importantly though, when we look at behaviour change, particularly the cost impact of lifestyle decision-based illnesses, smoking, obesity, and what drives adoption and engagement is when people feel respected and part of the process, they're far more likely to actively respond and take action. Patients, young and old, are increasingly using digital media and tools for communication and supporting them in many aspects of their life. To me, it would seem beneficial to look at how we can incorporate some of these tools and the data they create to help inform and improve health outcomes for patients. So what I hope for the future with the PCEHR. So I hope that in the next phase we can actually open up the system for more patient-integrated services. I would like to see an open environment where my health data is meaningful, and not only for my healthcare professionals, but also for other patients and for researchers and academics. What you see on the screen here is a screenshot from a presentation by Mark Scrimshire, who runs the Health Camp groups, and he's a big leading force behind this, the Rainbow Button Initiative. suggest you go and have a look at some of his presentations. It's a fantastic initiative to try and use some of the data in more ways and be able to, download it to your own computer, share it between health record systems, or donate it to academic purposes as well. And I hope that we can have something similar here in Australia. Above all, though, I'd say it's about self-awareness, empowering patients. Let me access my health data and use the tools and apps from big, small, whoever, development companies out there to help me make more informed choices about my healthcare. And in turn, I think you'll have a more empowered, more engaged patient. And I do believe that will lead to a reduction in the cost of care. I would also say let patients be honest and share our views on our experiences. We're doing it anyway, we know people are already going to the web and community social media outlets to ask questions and search for information and share their experiences. So my recommendation would be to take a proactive step and get involved in the conversation and let this be part of shaping a better health future rather than pretending it doesn't exist. Health is so much more than just medical care when you're sick. And if we really are serious about reforming healthcare, I believe it's not just about more money for more beds. It's about addressing the big elephant in the room, which is how we currently fund it. If I had a business selling water and got paid for each bottle I sold, and was then told, hey, we've got this fantastic plan to make people not thirsty anymore, I'm not sure I'd be highly motivated to be part of it. I hope the PCEHR is a starting point to look at empowering patients using technology to move more of the care away from expensive mainframe systems to integrated prevention-based care in the home. I hope it opens up debate and enables us to look at how we can reward and incentivize behaviours that reduce the cost of care and need for service, rather than just digitise the existing unsustainable model of care delivery. So in summary, I'm looking forward to signing up for my PCEHR on the 1st of July next year. I hope the collaborative spirit of engagement continues and consumers have a seat at the table and their voice heard for major design decisions. I can see the benefit for me in my health journey, and I believe for many others too. So please, let's get on board, let's support getting this initiative up and running, and let's make sure there's enough funding to keep it going.